Thank you for taking the time to watch the Morrow Homes COVID-19 Pandemic Plan and Response. This has been recorded for all staff. We're going to go over the current pandemic and how COVID-19 is affecting us at the nursing home, disease prevention and safety, Morrow Homes interventions and why we're doing them, droplet precautions, personal protective equipment, and a little bit about what we're going to do if we get a case of COVID-19 or if a resident becomes infected with COVID-19. So the World Health Organization is one of the sources for this information, as well as the Centers for Disease Control and Prevention, also called the CDC, and AMDA, which is the American Medical Directors Association. The World Health Organization defines a pandemic as the worldwide spread of a new disease, and that's what coronavirus is. COVID-19 is a new disease. Coronaviruses are types of viruses that we know about that can cause respiratory disease in humans. COVID-19, however, is a new type of coronavirus. It's a mutated one. So it's called coronavirus disease 2019. It's also being referred to as SARS-CoV-2 because it's similar to the type of coronavirus that caused the SARS outbreak, the pandemic in 2003. It's also similar to another coronavirus that caused the pandemic in 2012. But it's a disease that can cause pretty severe complications in older folks, like the ones we take care of, and can cause pneumonia, sepsis, lots of bad stuff. So it also has an incubation period of 14 days. So most people show symptoms if they have been exposed to the virus. Most people will show symptoms if they're infected within 4 to 5 days after contracting the illness. Not everyone is going to show symptoms 4 to 5 days after contracting the illness. Some people will be asymptomatic or not have any symptoms of the disease for 14 days after they're infected. So that's one of the reasons that we're all wearing masks all the time, is in the event that someone has an infection but doesn't have symptoms of the infection, that mask protects people around you if you cough or sneeze so that the droplets don't get into the air and infect people before you even know you're sick. So it's spread through droplets, like when you cough, sneeze, even speech sometimes can cause some droplet particles. Also caused by direct patient contact, and then you can get infected through indirect contact with infected surfaces. So like if somebody coughs or sneezes and those droplets settle on a surface that you're working on, the nurse's station, or a desk that you're at, your countertop where you're prepping food, the COVID-19 virus can be spread that way too. It can also be spread via the fecal-oral route, which is a very common way that viruses and bacteria and different illnesses spread. So a lot of people will present with a fever, cough, and fatigue. Not everyone who gets the disease is going to present like this, especially folks that we take care of with compromised immune systems. They might present a little differently, but most people, especially staff members, if they have symptomatic coronavirus, which means if they contract coronavirus and they do have symptoms, they will present generally with these symptoms. And you can go to that link that I have down there. It's the CDC website, and it takes you to clinical guidance about taking care of patients with coronavirus. So in the nursing home, the nursing home is a communal living situation. So in general, communal living areas with shared ventilation is where coronavirus can spread pretty quickly. Just like we saw it spreading on cruise ships or older apartment buildings with shared ventilation systems, you are going to see this virus get to more people. So that's why it's especially important for all of us to increase cleaning and hand washing and to learn as much as we can about how our residents will present with this disease so that we can quickly identify residents and other staff members who might get it. So as far as protecting our staff and our residents from the virus, we're going to follow the CDC guidelines. That's the Centers for Disease Control and Prevention. We're doing staff screening when the staff walk in. Everyone's going through that shared door. There's 2 different doors, Bridge Path and Nursing Home. So everyone needs to be going in through the designated entrances and completing the temp check and the screening prior to working. If you are sick, you must put on a mask and call your supervisor or a supervisor or a member of nursing management and let them know. Nursing staff are doing resident monitoring 2 or 3 times a day. There's new requirements for new admissions that we put them on droplet precautions. Hand washing, just make sure you're frequently washing your hands using hand sanitizer, that you know about the PPE that you need to use and how to don and doff that. And we do have our YouTube videos showing you how to do those things. As a nursing staff, we're reducing or eliminating ER and hospital visits when possible. Facility cleaning, because this virus can be spread through indirect contact if someone coughs or sneezes and the infectious particles are sitting on a desk or a surface or a handle or whatever that you touch. That can also transmit the COVID-19 virus, so making sure that you're cleaning those areas at several times a day per your department head, whatever your department head says. I know that the common areas, resident isolation rooms, and common areas are supposed to be cleaned twice a day. Trying to do consistent assignments, so making sure people are working in the same areas of the building all the time. And then we also have an isolation unit, just in case we do get a case of COVID-19. We are able to reassign the resident to a room that has a little bit of a setup that will hopefully prevent that virus from spreading to others. So the CDC says we're supposed to stop all communal dining and activities, and this is important because the disease, COVID-19, is more likely to spread if people are close together. The virus can live suspended in the air on very small droplets for several hours and can also live on some surfaces for 3 days. 1 case can quickly become 20 cases if an infected person is in close proximity to other people without a mask on, even if that person doesn't know they're sick. So that's why communal dining and activities were stopped. We also have to stop all unnecessary visits and visitors because our county does have cases, Mineral County does have cases of coronavirus that have been caused by community spread. And that means that people in our community have COVID-19 and they don't have any known exposure to another confirmed case. So there's people in the community who have the virus and they are spreading it to other people, but they might not know they have the virus yet because they're asymptomatic, which means that they have the infection, but they're not showing symptoms yet. And like I said earlier, you can go several days, up to 14 days of being infected with the virus before you have symptoms. So we can't allow visitors to come in and increase the risk of transmission in the event that they have an asymptomatic or a pre-symptomatic infection. And we're trying to make sure that we learn as much as we can about the early signs of the illness so we can put interventions in place to protect everyone. Make sure you're following that staff screening and doing what you're supposed to do there. Even mild symptoms could be deadly if a vulnerable person is infected. So please follow those screening questions, make sure you're healthy to work, and if you're not, we'll check you out and send you home so that we can decrease the risk of transmission to our residents and to other staff members. And then nursing staff's also doing that resident monitoring. If a resident develops respiratory symptoms, nursing has a procedure in place that they need to do to make sure that we prevent that spread of infection. And then effective hand hygiene is still very effective at preventing the spread of COVID-19. So let's watch our video, our YouTube video, where Emily will show us how to wash our hands.
Today we're going to review basic hand washing just as a nice reminder. Hand hygiene should be performed anytime prior to putting gloves on, after taking gloves off. The first step is turn the water on, get your hands wet, apply some soap, and we all know that the correct amount of time to scrub your hands is 20 seconds. Paying close attention to getting the fingertips around the back of your hands, around your thumbs. Those areas are frequently forgotten. In between your fingers, if you have a wedding ring on, minimal amounts of jewelry are okay. So you can sing happy birthday 2 times, you can say the alphabet. There's a number of songs out there right now. And there's my 20 seconds, so I'm going to finish up. Water doesn't have to be hot, warm, it's fine. Get them nice and rinsed. Always let the water kind of drip down. You don't want to shake it too much. Paper toweling. Dry your hands off. Grab another paper towel and shut off the faucet. Once you've completed all of that, you are good to go.
All right. Culinary does have some criteria that's a little bit different for nursing for hand washing, so please make sure if you have any questions about effective hand hygiene or what products it's okay to use that you make sure to ask Renee or Kelsey. So hand hygiene is important because COVID-19 can spread both directly through droplets and indirectly through infected surfaces. Also, we're seeing that people are shedding the virus in stool, so it can be spread the fecal-oral route. And the bottom line is that clean hands don't spread bacteria and viruses from one patient to another or one person to another. And you're a lot less likely to acquire the disease if you have clean hands. Even if you're instructed not to touch your face and stuff like that, but if there's no germs on your hands, then your risk of transmission is much lower. So just keep that in mind and be sure to wash your hands frequently when you're at work, if you have to go out to go to the grocery store, whatever you need to do, hand washing, super important. And then we also have personal protective equipment. We're going to watch a video on donning and doffing PPE for people on droplet precautions. Probably. Okay.
Hi guys, today we're going to run through on the correct way to put on your PPE and to take off your PPE as safely as possible. Hillary is our demonstrator today, so the first thing that you do when you're going to enter a room that requires PPE is hand hygiene. So Hillary, go ahead and do some hand hygiene. Alcohol-based hand sanitizer or hand washing for 20 seconds is appropriate. The next thing after your hand hygiene is complete is going to be to put your gown on. So once that sanitizer is dry, so we'll have you put a gown on. That gown is going to open in the back. So slip your arms in. The ties are in the back. There you go. Perfect. This can get a little tricky to tie it in the back, but go ahead and do your best. While Hillary's getting her gown tied up, there are 2 different types of face masks that potentially would be available for our residents requiring droplet or airborne precautions. An N95 mask, which is a higher level of protection for the person wearing the mask, is only going to be used in the cases of confirmed COVID-19 patients. Otherwise, yep, this is an example of an N95 mask. Otherwise, a surgical mask, the standard mask that we use for any type of droplet precautions, go ahead and put that on. Make sure it fits good over your nose and your chin. Squeeze it tight, got a good fit. The next thing, which is a little bit different for what we're used to, is going to be eye protection or a face shield. So go ahead and put on your eye protection just in case of a splash or spray. And then gloves is going to be the very last thing that you do. And when you put your gloves on, you're going to want to make sure that the cuff of the glove covers the cuff of your isolation gown the best that it can to limit any exposed skin or clothing. Once you have completed full PPE donning, which includes gown, glove, mask, and eye protection, you can go ahead and complete your resident cares as you would. And when you're ready to exit the resident room, the first thing you're going to do, once you're 6 feet away from your resident, is remove your gloves by pinching the glove and removing it, and then going under the cuff, just like that. It's okay. And then just let it go. There we go. Put them in the garbage can. Perfect. Next thing that you're going to want to remove is your goggles, and you're going to want to take them straight off your face and deposit them in the dirty area. Then you are going to remove your gown. So you're going to need to untie, taking care not to touch the front of your gown with your hands. If your hands become contaminated at any time during this process, go ahead and do another level of PP or hand hygiene. So go ahead and remove your gown, Hillary, from the back and just peel it off so it's inside out. Perfect. Then you would roll it and put it in the laundry bin. In this case, it's disposable. It will go in the garbage. Now you perform hand hygiene. Perfect. Just great. Step out of the room and remove your mask. In the event that you're using an N95 respirator, those masks will be used multiple times over and over. You will not throw them away. For the time being, a standard ear loop mask is a one-time only mask. If you have any questions about donning or doffing your PPE or how to safely do it or anything else that comes up, please ask myself, Mallory, or Jen. Thanks, guys.
All right. We do have other videos that are uploaded on YouTube about some other topics that you guys can access. Emails have gone out, but if you want the link, please just ask your department head. This sign will indicate that a resident room requires droplet precautions. If you are going into this room, you will need to don PPE. Housekeeping staff does need to put PPE on to clean these isolation rooms. PPE is important because, as we talked about before, people can carry and spread COVID-19 before they have symptoms. The extended wear masks offer some protection to the residents and our fellow employees if staff are wearing them all the time by containing or trying to contain the virus just to the infected person. Placing all newly admitted residents on droplet precautions protects employees and other residents if the newly admitted resident has COVID-19 but is not yet showing any symptoms. And N95 respirators will help protect the staff that are taking care of residents who have been diagnosed with the virus and are on a closed unit completing procedures that might cause the virus to be aerosolized or airborne. Some things cause the virus to be aerosolized or to live in the air for a few hours, but that is not thought to be in general how the virus is spreading. And that is just happening when you are performing aerosolizing procedures that nursing would do, like nebulizer treatments, O2 application, cardiopulmonary resuscitation, putting in an airway, that sort of thing. So that's a lot more likely to be the case in the isolation unit or in a hospital that's treating very, very sick people who have COVID-19. Extra facility cleaning is a lot of work, but it's very worth it. So the products that we're using are EPA registered hospital grade disinfectants, and we have to make sure that we're cleaning the high touch surfaces and areas at least twice daily. The wipes in the green canisters, we can wipe down lifts and vitals machines between use, alcohol swabs to clean pulse pulse oximeters and stethoscopes between use. And then if housekeeping isn't present, nursing does have to sanitize the rooms after visitors leave if they are approved for compassionate care visits. If there is a positive case, there are procedures in place that we will activate for nursing to transfer the resident for the housekeeping duties of the positive unit and to get food, drinks, supplies to that isolated unit. The goal of that unit is that we will restrict access as much as possible. So most people that are not in the nursing department will not be asked to go onto that unit for any reason. But you may have to deliver supplies. As always, if you have any questions about anything contained in this video, please ask me, Emily, Jen, or your department head. So let's go through the quiz. What are 2 complications of COVID-19? Coughing or sneezing, sore throat, fever, and pneumonia and sepsis. And this is quoted from slide 4. The complications of COVID-19 can include pneumonia and sepsis. The other things are symptoms of the disease. COVID has an incubation period of how long? And the answer is 14 days. So this means that a person can have an exposure and contract the illness and not show any symptoms for 14 days, although most people will show symptoms 4 to 5 days after contracting the illness. During the incubation period for COVID-19, infected persons are not necessarily symptomatic but can still spread COVID-19 to others. Is that true or false? And that's true. Per the CDC, the virus is especially transmissible because you can become infected by having close contact with a person who has an asymptomatic or pre-symptomatic infection. When residents are infected with COVID-19, they will always present with the same sets of symptoms. Is that true or false? And that's false. Residents who are already immunocompromised might not present with the same sets of symptoms or symptom severity as someone else. This can vary really a lot from person to person and age group to age group. So coronavirus is spread through coming into contact with the droplets produced by an infected person after they sneeze or cough, touching a surface with living virus and then touching your eyes, nose, or mouth. C, being in close proximity to other infected people in communal settings where the virus may be living, although temporarily suspended in the air, or all of the above. And that is all of the above. This is why hand washing, wearing your mask, and staying home whenever possible are the best ways to ensure you reduce your risk of contracting and spreading the virus. Additionally, cleaning frequently touched areas also helps prevent the spread of the virus because the virus can live on some surfaces for several days. Why is it important for staff to wear an extended cloth mask while at work? Is it to protect the staff member from catching COVID-19? Because nursing management enjoys making people miserable? To decrease the risk of transmission of the virus to residents and other staff members in the event an employee is infected but not symptomatic, or D, all of the above? And the answer is C, to decrease the risk of transmission of the virus to residents and other staff members in the event an employee is infected but not symptomatic. What order does a person don or put on the following droplet PPE? And this poster is from the CDC, shows the correct order for putting on personal protective equipment. You gown, don your mask, put on your goggles, and last, put on your gloves. In what order does a person doff or take off the following droplet PPE? Gown, gloves, mask, eye protection. And this shows the order in which people take it off. Gloves, goggles, gown, or and then mask last. There is an alternative to this, and that's posted on all of the doors in general. For learning purposes, we are just going to use this. Why should communal dining and activities be stopped during a pandemic? And that is because the disease is more likely to spread rapidly if people are close together. If I have questions about COVID-19 or ways to protect myself and my residents, I should consult Mallory, York, and Emily Bozak, who will get all of their information from reputable sources like the CDC, WHO, and AMDA. Facebook could also be extended to Snapchat. My friend who's an expert on conspiracy theories, or my essential oils reference guide. I would recommend talking to me, Mallory, or Emily, who will get all of their information from reputable sources. You can also have, you can direct your questions to your department head, and if they don't automatically know the answer, they can also contact us and we can get back to them. So let's just make sure that we go to the right people for our information. Go to your department head, go to the CDC website, and come to me and Emily if you have concerns or you need help understanding the information that's out there, or if you have questions about the things that we're doing here. Anyway, that's all I've got for you. Please complete your quiz and turn it in. Again, this was for all Morrow Home staff. Thank you.